Hello, everyone. Today's episode is about healing trauma using a method called internal family systems therapy. Today's episode is a dual episode in that I'm featuring it on my Overcoming Chronic Illness podcast as well as my Optimistic Future podcast. I've done this with a few other episodes in the past because there's just certain topics that, in my opinion, relate to both the themes of both podcasts. So, for those of you who are not familiar with one or the other podcast, the Overcoming Chronic Illness podcast is a podcast that talks about complex chronic illnesses, things like fibromyalgia, chronic fatigue syndrome, chronic infections with microbes like Lyme disease, mold illness, heavy metal issues, chronic digestive disorders, et cetera, et cetera. So folks who are basically struggling with symptoms for a prolonged period of time. In my extensive experience as a naturopathic doctor working with patients, dealing with complex chronic illness, over the last several years, I've seen a maybe not growing trend, but it's just been reinforced in my mind more and more with each passing year that a lot of patients who are dealing with chronic health issues have a lot of many of them, if maybe not all of them, but almost all of them have at least some degree, if not a major degree, of nervous system dysregulation. We, in the last few years, have been working with something called brain mapping using quantitative and electroencephalography or QEEG brain maps. And so we actually have testing now that we can get objective data showing us what we've kind of known clinically for a long time, that a lot of folks dealing with chronic health issues just have a lot of nervous system internalized stress, a lot of nervous system dysregulation. That makes sense because when someone's suffering with a lot of symptoms, their hormones are maybe off whack, their pain receptors are, hypersensitized. They're releasing histamine too easily. They're reactive to different foods and supplements and environmental triggers and chemicals and things like that. And the nervous system is one system in our body, or one of the systems in our body that's responsible for trying to regulate everything. So when a lot of areas of the body seem to be kind of going to heck in a handbasket, it makes sense that there be nervous system dysregulation. And so, indeed, there are different methods like, HRV training and amygdala retraining and wonderful online platforms like Primal Trust and different things like that that are really helpful for folks. And then, we can get objective data with our brain mapping to see that this is indeed something that seems to be going on, and treatments like neurofeedback and other therapies can be really helpful. So the tie-in there with internal family systems therapy and healing trauma, and bearing in mind that internal family systems therapy, as we'll get into here in the meat and potatoes of the podcast here, is it's one of the, in my opinion, one of the best, if not the best, kind of foundations in a trauma-informed therapy approach. So that's the tie-in there with the Overcoming Chronic Illness podcast. With the Optimistic Future podcast, which is a podcast that focuses on mostly, well, it's evolved over time, but it started out as a podcast that was mostly focusing on small steps, or easy steps, I should say, that we can all take on a daily basis to help make the world a better place. Whether that's abstaining from using artificially scented products, which are filled with chemicals that are really bad for us and everyone around us, bad for the environment, etc. Or it's shopping at farmers markets to help with local agricultural economy and local keeping food prices down, etc. Or it's minimizing food waste because way too much food winds up in landfills because of various practices, and there's food saving programs and things like that are out there. So that it's little steps that we can all take to make the world a better place. Helping on say an economic level, a social level, an environmental level. The podcast also talks about certain things that we can do to take larger steps, more time-consuming steps, if we're feeling really particularly passionate about a project. And then I've also kind of started talking a bit about more like just kind of global, kind of like bird's eye view, top-down things that could be considered and worked on, just kind of forecasting into the future about just kind of the way that our society is going, how things are going to be impacted by just future changes with AI and robotics and different things like that. So anyways, that podcast is kind of taking a bit of a life of its own, but anyways, that's the gist of it. So the tie-in with the Optimistic Future podcast is that, in my opinion, which I say this kind of just as a, fellow citizen of Mother Earth, but also as a clinician, as a naturopathic doctor, I would say that to my understanding, unresolved trauma is something that is really not good for us individually, but it's also not good for us collectively either. When trauma is unresolved, then these patterns tend to be passed on from generation to generation. They have an impact on our friends, our other, our non-children family members. And then that's something that's going to have a collective effect on the whole, because if we have unresolved trauma, that's going to have an impact on our mental health. And, maybe some of us do just fine with that. Maybe we're maybe suffering or having some challenges, but it's not having maybe a direct societal impact. In other cases, like it might cause some people to need to go on, stress leave. It might have other impacts on, our mental health, and that can have an impact on society as well. So the long and short of it is that I think that if we integrate trauma, and then by doing so, don't inadvertently perpetuate future trauma on, future generations, et cetera. That's one of the best things that we can do. As a naturopathic doctor, we talk about, trying to address the root cause of what's going on. At the end of the day, if there's, if there's a river and the river has poison in it, well, you could put a poison neutralizer in the river, and like, okay, now the water downstream from that is safe to drink. But if there's a chemical plant that's just dumping poison into the water upstream, it's like, well, you should probably just shut that plant down. That's probably going to be the most effective thing to do to, treat that scenario, that case. So addressing the root cause of what's going on is just kind of the way that my brain is wired. It was beaten into me over my years of training at naturopathic school, and it just also makes good logical sense that if we can treat those systemic, like kind of, or if we can treat the root causes of these systemic issues, that makes a lot of sense. So I think integrating trauma as effectively as possible is a winning strategy, because some of the things I'm talking about today do relate to clinical related things, kind of health, like mental health related things. I will just mention a quick little caveat that nothing I'm saying in this podcast should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. At some point, I would like to interview someone who is a dedicated internal family systems therapist. This is going to be a solo episode today. I'm going to just talk about my experience with IFS therapy to date. I've been using this with some of my patients. I read the internal family systems therapy book by Richard Schwartz, or Dr. Richard Schwartz, who developed the therapy, I believe, like 20 some odd years ago. So I read that book. I was inspired to read it after I read the book, The Body Keeps the Score by Bessel van der Kolk. Amazing book, very hard to read book, but, because it's very emotionally charged and challenging to read, but amazing book all about trauma-informed therapy. He has a whole chapter dedicated to internal family systems therapy in that book. So I read the IFS book because of that, and I was just completely blown away. So it really resonated with me. So I went and did additional training in internal family systems therapy. Been using it with some of my patients, and that have referred many patients for IFS therapy with dedicated IFS therapists, and it's been very helpful. I'll talk about what IFS therapy is all about in just a moment, but just for context, I suppose, I've had several patients now where I've said, okay, we did their brain map and said like, hey, you've still got, there's some signs on here showing that kind of the centers of your brain, or the areas of your brain that are really important for emotional consolidation, kind of like emotional integration, like they're just really not communicating with each other well. I think that you might have some unresolved trauma based on that. And I'll say like, yeah, I think I do too, but I've been in therapy for the last 10, 15, 20 years. I've done cognitive behavioral therapy, talk therapy. I've done, journaling. I've done, breath work. I've done meditation. I've done all these things. And like those things have all been helpful, but like I'm still anxious. I still get triggered by this and that. Like, I'm still having this same old pattern with my romantic partner, my spouse, whatever. Like, I feel like I'm like Teflon when it comes to therapy. And so then I say, well, I explained to them sort of why IFS therapy, internal family systems therapy, is different, or like what makes it special. And they, thankfully my patients trust me, and we have good rapport, and they say, okay, I'll go do it. So either they're working with me, they're working with somebody else, and after they get into the therapy, like, oh, I see now. I see that this is different. This is making a shift, and not only is it just philosophically, or I guess like they're like, oh yes, it is philosophically different, but they're also seeing the results in practice and day-to-day life, where it's like, oh, I'm not feeling as anxious about things. I'm actually finally able to kick that food addiction. I'm actually like that same old pattern that I've been stuck in with my partner, my spouse, whatever. Like, I'm not getting like I'm just not getting triggered the way that I always was before, no matter like what I did. I'm doing my cognitive behavioral therapy techniques, and like it's just like I'm still getting triggered. But then now I've done the IFS work, and like I'm not getting triggered now. So um, again, as a clinician, I'm always, I love reading about theory. I love reading about pathophysiology. I love looking at background information. I love mapping out, like learning about biochemical pathways. I love all of it. I love reading studies. Like I'm completely in love with all of that. Um, However, what's the most important to me is like what actually works in practice. If a study says like, oh, you should take this supplement and it, shows a reduction in this or that, it's like great, but like, does the patient actually feel better? This therapy, like, cognitive behavioral therapy has been helpful for this or that, and great. Like, is it helping? Well, if it's only making a little bit of a difference, then like, well, let's find a therapy that's working better than that. And are we actually seeing those differences? So that's what a lot of these patients who have done like lots of different types of therapy, they're like, oh, this is different. This is actually making a shift. Now, I'm certainly not insinuating that everyone who does IFS therapy within like 2 or 3 sessions, they're like, oh, crutches are thrown down and I'm feeling like $1 million. Like it is a process, but there's something very very special about this approach, in my opinion, and that's why I wanted to make a whole podcast episode about it. So, with that preamble out of the way, what is IFS therapy? What's it all about? So, internal family systems therapy, as mentioned, was developed by Dr. Richard Schwartz about 20 some odd years ago. He details the whole history of how he kind of developed the therapy in his book, Internal Family Systems Therapy. It is in its second edition. So if you're inspired to read the book, I recommend the second edition because it's updated, of course. And so he had basically tried a few different therapy approaches over time and just found that he was not getting the clinical results. Like, even though it was like what was done at the time, he just wasn't seeing the results in practice. And then there was sort of this like, almost like this serendipitous kind of like epiphany, also kind of like there's sort of this existential crisis moment in practice, which kind of turned out to be serendipitous, and he had an epiphany, and then basically from the ashes rose the phoenix that is internal family systems therapy, and then it was actually working, and so then he built upon that and eventually developed a whole method and started training clinicians how to use this. One of the things I really like about internal family systems therapy, kind of the culture around it, is that it's very like open and accessible. So there's some methods out there, like say EMDR therapy, great therapy for trauma informed therapy, but the EMDR sort of culture, if you will, is that like it's only for psychologists, it's only for psychiatrists. With IFS therapy, it's very open. They don't have like a lot of I guess hurdles, if you will, like around like who can access IFS therapy. So like it's something that medical doctors can use, psychologists can use, counselors can use, social workers can use, naturopathic doctors can use, even like health coaches, life coaches, etc. Of course, if someone's dealing with really like severe trauma, like that's where I'm saying like, hey, you got to go work with a psychologist or counselor or social worker who like specializes in this. Like I'm not going to work with you in that case, but just for folks who like you don't have to be dealing with like severe trauma to be benefited by internal family systems therapy. It's something that can be in my opinion, helpful for anyone. I feel like there's like life skills within IFS therapy that are good for just about anyone well, really for anyone to learn. So anyways, getting back to like, what is IFS therapy? So Dr. Schwartz develops this 20 some odd years ago. And so my understanding of it, and again, Dr. Schwartz does the best job explaining it in his book because it's his baby. So if you're inspired to learn more about it, either listen to him being interviewed somewhere on YouTube or elsewhere, or read his book. Or listen to the audiobook. It's an amazing book. But basically, the gist of it, to my understanding, is that with internal family systems therapy, the idea is that who we truly are is our self. So the self is kind of like essentially like who you are when you're at your best. Dr. Schwartz talks about the 8 C's. See if I can remember them off the top of my head here, but there's basically if you're feeling calm, if you're feeling curious, if you're feeling compassionate, feeling content. Oh my gosh, well, I got half of them there. Anyways, I'm on the spot, but basically, if you like, kind of roll out of the bed, and you roll out, if you get out of bed on the right side of the bed, you're like just feeling good, connected, loving, like you're in your kind of best self energy. That's what self energy is. That's the idea, is that that's who you truly are. But when certain circumstances arise in life, then there are different parts that we have that will kind of come to the surface to help you to handle circumstance or whatever comes up. So for example, if I, get out of the bed on the right side of the bed, I'm having a great day, great breakfast with my wife and kids, head off to the office and then, driving, get out of my car in the parking lot at my work. And then I see someone, I don't know, like trying to break into somebody's car. I'm going to have a part that comes up that's like, oh, like that's not okay. Like I might have like an angry part or a defensive part, like, hey, like that's a fellow human being's car. Like this is not okay. And so then I might, head over there and, say like, hey, buddy, like get out of here and, chase him off. And that would be like an angry part, more of like an aggressive part that would come out of me because like I need to be big and tough. If I just kind of go over being all meek, like, please don't break into that car. Like he might attack me. I don't know. So in that case, my angry or aggressive part would come up because one could argue that would be appropriate in that situation because I want to save a fellow human being's property. And then after, person runs off, then I can go back into my self energy. It's like, might take me a little bit to calm down, 5, 10, 15, 20, 60 minutes, whatever it is. But then it's like, okay, that angry, aggressive part, calm down. And like, now I'm back in my self energy. I'm feeling nice and balanced and regulated. Or if I had, say, a family member who, I got a text from my mom saying like, oh my gosh, like, your cousin's in the hospital. They're having some weird symptoms. They're waiting for test results to come back. They're not sure if it's like something really easy to treat or if it's cancer. It would make sense for me to feel anxious. An anxious part would come up because I love my cousin and I don't want him to have cancer. And so I would feel it would be appropriate to feel anxious until, I get that text where it's like, oh, no, everything's fine. It turns out he's just anemic or something. And it's like, it's going to take iron and he's going to be fine. Then I was like, okay, then my anxious part recedes into the background. And then I'm back in my self energy. I'm feeling good and balanced and whole and healthy and all that good stuff. And so that's kind of the idea where who we truly are is our self energy. But then we have these parts that will come to the forefront to, deal with or help us to deal with the different circumstances that life might throw our way. So that's the way things kind of quote unquote should be. And in IFS therapy, that's what they say, the way things should be. Where the problems come along, where the pathology comes along, is if we have certain parts that get activated and then they don't recede into the background. So if, for example, say there's, little kid, 5 years old, and he has a mom who is anxious and she's kind of a perfectionist because she probably had a mom or a dad who were anxious perfectionists. And so, but we won't get into that. We won't get into the transgenerational stuff here. But let's say, so a little 5-year-old has a mom who's like, really like she ties her self-worth into like what his appearance is like, what, the appearance of her home is like. And so, and if he comes home, like he goes to school and has a great day, but he comes back with like mud on his jeans, it's like, oh my gosh, like he gets in trouble. Or if his room's not spotless, he's in trouble. But then when he is clean, like when his clothes are clean, when his room is tidy, then his mom is like, demonstrative and affectionate and all of that. And so he starts getting the message that you need to be neat and tidy and perfect in order for you to get love from your mom. And as a child, the love of our parents is the most important thing in the world. For all intents and purposes, when we're little kids, our parents are like gods to us. And so we really want their love and approval and affection. And so that little kid gets the message that, well, to get love, I need to be perfect. And so he's going to start to become a perfectionist. And of course, you can't be perfect. I would argue that we're all perfect in our imperfections, but that's a philosophical discussion for another time. So for sake of discussion today, we can't be perfect as humans, especially as kids. We're going to fall, we're going to like forget to put stuff away, kids get distracted, whatever. And so he's going to fail on a semi-regular basis. And when he fails, he doesn't get as much love from his mom. So he's like, oh, I'm failing at being perfect. And so he's going to feel anxious. He's like, oh no, like I failed. Like, oh, it feels bad when mom doesn't give me hugs or doesn't, gets mad at me. So then he's going to feel anxious, but like, okay, like I can't mess up. I can't mess up. I can't mess up. So his anxious part is going to come to the surface more often than not, and he's going to have this perfectionist part that comes out to the surface. And so he's going to those parts are going to start kind of taking over. So instead of him just, living in his, kind of blissful self energy all the time and just having those anxious parts or perfectionist parts come out when it's appropriate situationally, he's going to start kind of embodying those parts, or as they would say in IFS lingo, like he's blending with those parts. So it's kind of like you kind of forget about, like it's almost like when you hear those stories about actors who like just, like Daniel Day-Lewis or something, like where it's like, oh, he just like became that character when he was preparing for that role. Like it's kind of like and then the lines start to blur between who am I? Am I me? Am I that character? It's kind of like that with internal family systems therapy philosophy with our parts, where it's like, oh, like am I self energy or am I that anxious part? And then so the anxious part starts to kind of like take over. And so now we're embodying that. And so that's going to lead to people, say in the case, this little 5-year-old who eventually becomes bigger, maybe becomes like, now down the road, he's like, a 35, 40-year-old, like anxious perfectionist adult. And as we kind of say blended with these parts, it's emotionally painful to experience that. So we have like stress and unpleasant feelings that come with this. But then what gets challenging is that as these parts take over, especially when these parts take over at an early age, then the parts, it's almost like we kind of personify the parts to some extent. So just bear with me with the lingo here, but it's almost like that part starts to think like it's actually in charge, or the person starts to think like, oh, I actually am that anxious part. And so then when that person says like, well, I don't like feeling anxious, so maybe I'm going to, stop. And like I feel they have the realization like, oh, when I try to get, say they go see a counselor, they're going to go do some talk therapy, some cognitive behavioral therapy. And so they're like, oh, I'm going to start doing some, or they just have some self introspection, or a friend talks to them or whatever it is. They're like, okay, like I'm going to try to like just let stuff go. Like I'm going to try to, not worry about getting straight A's in my, my university classes, or I'm going to, it's okay if my boss, doesn't think that I like gave me like suboptimal praise on that project I was working at work. These parts could become so ingrained that when something is not going, like when that perfectionist is not getting, the praise they were expecting from their boss, or they didn't get, 100% on the exam, they only got 98%, then these other parts can come to the forefront to that will be like really quite harmful and quite frankly like abusive to the person in question. So there might be, say, like an addictive part that comes up where it's like, oh, you know what, like it's very painful not being perfect. It's, there's these underlying feelings of like you're not lovable. That there's underlying beliefs of like, you're not lovable if you're not perfect all the time. That's very painful. And so then there may be some what they call firefighter parts that come to the forefront, being like, okay, feelings are getting a little too real here. We need to distract, distract, distract. So that person might say, fall into like a video game addiction, a gambling addiction, a food like a emotional eating, which could also be construed as a food addiction. And so there can be these, or maybe it could be self-harming, like, self-cutting or something like that. Like, so there can be these more extreme behaviors that might overlie on top of those. Now, of course, not everyone has those challenges or issues, but that's how like different parts can kind of layer on top of each other. And so in internal family systems therapy lingo, there are these manager parts, there are these firefighter parts, and there are also what they call exiled parts. So those exiled parts are kind of those like really deep down parts, the parts that are feeling like unloved, unworthy, like if I'm not perfect, my mom doesn't love me, I'm not worthwhile unless I'm perfect. That would be like an exiled part. A manager part would be more like the anxious part, the perfectionist part that's saying like, okay, you need to like be this way so that it kind of keeps that exiled part kind of off, like keeps those feelings, say in this example with the 5-year-old who's now 35, 40 years old, keeping that part kind of protected, so to speak, to say like, okay, it's really painful to not feel loved, so let's just keep on being anxious, let's keep being perfectionist to try to distract from that. But then being anxious and failing at perfectionism, because again we're humans and can't be quote unquote perfect, then there could be these firefighter parts that come to the scene of the mental emotional pain as needed to try to distract from that, where it's like, okay, the anxiety is coming up too much, so now let's just go eat some chocolate cake, now let's go do some online gambling, now let's go just play video games for 8 hours, and stay up until 2 o'clock in the morning and not get enough sleep, and kind of like just it's this distraction. So that's kind of the overview of like how things can like how things ideally should be in the IFS lens of like we're just in self energy. We have parts that come up as needed, and but we're generally living in self energy, feeling good and contented and calm and happy and curious and all those good C's plus an H, the happy H in there. Um, but then that's also how things can go south. Um, so with IFS therapy, the whole idea with it is to identify these underlying parts, get to know those parts and see where they're coming from. Now, one of the things that I kind of alluded to but didn't really say outright, so I'll say it right now, is that one of the many things I really love about IFS therapy is that it's a very loving approach. It's an approach that doesn't condemn any of the parts of the patient's, emotions or psyche. And so what I'm alluding to there is that in this example with, the 5-year-old with the anxious and perfectionist parts and say, let's say he's got a video game addiction, let's say it's a, firefighter part has this exiled, part that feels like unworthy or unlovable. Um, so none of these parts are actually bad. Dr. Schwartz's first book, if memory serves, he has a book called this. I think it was his first book. It's called No Bad Parts, and I love that. Like whenever I'm doing IFS work with my patients, we always start with this mantra of there are no bad parts, because the thing with these parts is that they're trying to protect you. Your parts are trying to protect you. They are doing the best they can, armed with the information that they have, to try to protect you from, emotional pain and turmoil. And so we never want to condemn those parts. And that's where, again, it's nothing against, cognitive behavioral therapy or talk therapy or other more like say intellectual based therapies. IFS therapy, in my opinion, there is certainly an intellectual component to it, but in my opinion it's really more of like a feeling based therapy. As I say to my patients on a regular basis, when we sustain these wounds, when we sustain these traumas, especially at an early age, but even at, non-child ages as well, these wounds are emotional. And in my opinion, to my understanding, like if we want to heal an emotional wound, we need to work on an emotional level. We can intellectualize things till we're blue in the face, and it can be helpful. If someone listening to this, like, hey, I've done CBT, cognitive behavioral therapy for years, and I feel like $1 million, like, wonderful, congratulations, that's great. And many patients do great with CBT. Big fan of CBT, but in my experience, folks who do not feel 100% just from CBT alone, an emotion-based treatment or an emotion-based method like IFS therapy is going to be um, oftentimes very, very good at helping with an emotion-based problem, which is trauma. So the so got myself off track there. So going back to the no bad parts idea. So with these parts, they're just doing the best that they can to try to protect us. And so there's no right. So I think what I was going to get at there was um, I've studied cognitive behavioral therapy again, not to throw it under the bus, but just as a comparison here, where it's like, okay, I have these, automatic negative thoughts. And so like, I want to get rid of those thoughts. I want to replace those thoughts with these, what they call positive coping statements. And so it's, maybe it isn't explicitly said, but sort of like, oh, okay, I've got these like anxious thoughts. I've got this anxious part. Let's just try to get rid of that. Let's kind of replace that part with this new part or with these new ideas. And again, if it's working well, that's great. But in a lot of cases, in my experience at least, like it's not, it's helpful. Like it kind of turns the dial down on the anxiety or on the mental emotional symptoms. But if it doesn't fully eradicate them of those symptoms or the unwanted feelings, it's probably because that anxious part is like, I've got an important job here. Like going back to our 5-year-old who's now 35 years old, we'll say, his anxious part is protecting him, trying to protect him from those feelings of not feeling lovable, of not feeling worthy. And so if that anxious part is like, no, this is a really important job. Like again, for a little kid to feel unloved or not fully loved by his mom, that's like the worst thing ever. Like it might sound dramatic, but like in many respects, like death would be a preferable alternative. And indeed, there's some very interesting, I think, very relevant applications of IFS therapy to like folks that are suicidal. Like it's again, these are not the patients that I work with because that's just higher stakes and outside of my pay grade. But like some very very compelling stories from Dr. Schwartz and others who do this work, where folks who are suicidal, it's like you get to talk to their parts, and it's like, yeah, like death would be preferable, like to experiencing these raw emotions. When you start to do that healing work, it's like, oh, that suicidality like goes down, goes away. Like it can be amazingly impactful. But that's just to speak to the gravity of how tightly some of these parts are going to cling to their protective rules. It's incredibly, it can be incredibly powerful. So, of course, in a case like that, it's like we can't just talk that anxious part out of it. It's like, no, like I'm protecting this little kid from, these like really awful, overwhelmingly bad emotions. That kind of ties into another point where our parts, when we actually start when we start doing parts work, parts oftentimes are stuck in the past. So it's one thing to be like, okay, yeah, like this guy's 35 years old, like he's lived some life, like he can maybe handle this, and intellectually or even emotionally, like kind of recognize it, like, yeah, like no, you can be lovable even if you're not perfect. But oftentimes the parts are stuck back at, say, 5 years old, at 2 years old, at 7 years old, at 13 years old, at a time where they the person in question, that 5 year old, like did not have the mental development, the emotional development, the resources to be like, oh yeah, like, I understand my mom has some stuff going on. So like, this is kind of her stuff, not mine. This isn't a reflection of me. So no, I am lovable. This is like kind of my mom's baggage. Child doesn't have that capacity. It just, it's kids are just living in the moment and not that self-aware, not that like, globally aware, of course. And so part of the parts therapy is actually like re-educating the part that, like, no, like, he's an adult now. He's 35. He's not stuck back in that pattern anymore. And so, anyways, we'll get into how the parts are healed in just a minute. So let's see here. So yeah, so there are no bad parts. And so yeah, so again, one of the things I really love about IFS therapy is that it's a very like loving, like patient-led, patient-centered approach, that is not condemning in any way, shape, or form. It's about like really, it's kind of like if you had a group of people, let's say on a job, like let's say they all worked in an office, and like nobody was getting along, and like everybody's like kind of bickering and this and that. It's like at the end of the day, like nobody in that office is bad. Like they're not, we'll just pretend for a minute that nobody there is actually a sociopath. So nobody's a sociopath. It's just like, that person has some stuff going on at home. That person, maybe has some health issues. That person's been, maybe, taken a lot of, had issues in previous job sites. So they have like a bit of trauma from workplace stuff. But if you just get a good HR person in the room as a mediator, you're going to get everybody like on the same page. Like, hey, we're all on the same team. We're all like, we want the company to do well. We all want to do our jobs. We're all trying to make money. We don't want the company to shut down. Like, let's just kind of like work out our stuff, and then we can all work together moving forward. It's kind of like that with parts work or in IFS therapy. And indeed, when I'm working with my patients, like I'll invite patients to kind of like picture like a boardroom table where it's like you are that mediator, you are that HR director, and you're here to say like, okay, come to the table, and like nobody's going to get fired. We're not going to cut anybody off. Nobody's going to, parts, none of the parts are going to get killed. We're just going to work with the parts, see where they're coming from, and then you see like, oh yeah, like Joanne and Laura, like the office workers in this metaphor here, it's like they're just like bickering all the time, and it turns out that Joanne thinks Laura keeps on stealing her sandwiches from the fridge, and Laura thinks that Joanne keeps like never filling up the coffee, but it turns out that like there's, I don't know, like somebody else is stealing the sandwich, and somebody else isn't filling the coffee pot. They, oh, I had no idea. And then they have a big hug and realize it was just a big misunderstanding, and like now they're friends, and it's great. It's obviously not quite that cut and dry with IFS therapy, but that's kind of the gist of it, where we're not condemning any parts. We're just seeing like, oh, that's why you're doing what you're doing. You're causing anxiety because you're actually protecting this little 5 year old that's not feeling loved. And so it's actually what's always very heartwarming to me, and quite frankly, I get the whole body tingles, every time this happens in my office when I'm doing IFS therapy with my patients, is that when patients like meet a part for the first time, they're like, okay, there's a lot of kind of like kinesthetic experiencing or visualization when folks are doing IFS therapy. So maybe I'll quickly segue into what the actual process looks like, and this will make more sense. So with my patients, at least, I combine this with a bit of clinical hypnosis. So the patients, relaxed, eyes closed, doing some deep breathing, kind of get into a nice kind of like sort of quasi meditative, like mild hypnotic state, and then we kind of start. They kind of check in with their bodies and say, okay, which parts want to be worked with. And so with some patients, they're very visually oriented, so they'll picture that boardroom table, they're seeing the parts. Other patients, they're more kinesthetically oriented, so they'll be like, oh yeah, I kind of feel like this tightness in my chest, and then we'll kind of explore that. I haven't yet had a patient where like they're mostly smell driven or taste driven. It's like, I taste like I taste my part, like that's not a thing I've seen, but maybe there's people out there. It'd be interesting to know if there are. But usually it's either seeing things or feeling things. So for example, I'll have patients, they're like, yeah, so I'm seeing myself at the boardroom table, and then like, okay, so which parts need some attention? So like, yeah, I see a few, parts sitting around the table, but like, oh my gosh, like there's this blob of, like dark, like fetid black smoke. And it's like I'm feeling like really anxious looking at this, or I'm just feeling like really like, overpowered by this. And so then they start working with that part. And what's amazing, and maybe that's like their depression part, maybe it's a anxiety part, maybe it's a, I don't know, just an overwhelmed part or something like that, a part that is contributing to their panic attacks that they're getting. And what's really amazing is that as they talk to that part, kind of see like where that part's coming from, figure out like what role is that part serving? Like, so at first to be like, oh my gosh, like there's a blob of fetid black smoke. Like, let's just like, I don't know, call the Ghostbusters or something and like get that sucker out of here, or like, let's get rid of it. Let's run away. But what we do with our parts, regardless how they look, I've had patients say like, it looks like this, evil demon. It's like this, like, big hulking, like scary figure. And then sometimes it's like, this like, cackling old woman, some like, there's anyways, different ways that part, sometimes it's like just a little orphan kid, like looking like Oliver Twist or something. But regardless of whether it's like blob of fetid black smoke or a big ogre or something like that, the patient, their self, they get into their self energy, and then they talk to the part and see like, well, what's going on? Tell me about yourself. And invariably, the part ultimately relays a story where it's that like, oh, I'm protecting you from this, or I am doing this because this part's doing that, and so like I'm doing that to kind of like essentially like distract you from that other part. And what's really amazing is that these parts over time, they invariably morph into something quite a lot more pleasant. They morph into like, it's like that ball of black smoke. It's like, oh, like it actually morphed into like 5-year-old me or 13-year-old me, or whatever it was. Or like, oh, now it's like, maybe it's not me, but it's just like some, cute little kid, or like some, like, um, uh, artsy looking teenager or something like that. And so like these parts, like again, we're not demonizing any of them. None of them are bad. It's just, but they can be very like imposing. There's like they're causing symptoms. It's kind of like, if there's someone who's well intentioned but doing something bad, it's like, I can't think of a movie off the top of my head, but it's like, one of those movies where like there's someone who's like, there's a character who's like misguided. And so they're like about to like cause the whole world to end or something. And it's like, no, no, like you don't understand. And then they realize like, oh my, I had it totally wrong. And then they like are able to save the world instead of ending it or something like that. It's kind of like that with parts where they're not bad, but they can be, I guess, misguided would be maybe the way to put it. So when we're doing this actual parts work, again, like so as I mentioned, it could be visualizing a part. If folks are more visually oriented, or sometimes it's like, okay, I'll kind of use the language of so their eyes are closed, then that relaxed kind of quasi meditative, mild hypnotic state. And so asking, okay, like, so do you see any parts? Do you feel any parts? And it's like, well, I feel a tightness in my chest. Okay, so yeah, so if you can connect with that tightness in your chest, and like, are there any emotions that are coming up, or can you talk to that part and just say like, what does it want to tell you? It's like, well, like, it's feeling like anxiety. It's like, okay, so then, you're kind of connecting with that feeling, more of that kinesthetic experience, as opposed to like visualizing, like, I don't know, a kangaroo or something like that that's representative of the anger spectrum. I've never seen a kangaroo. Kangaroos never come up actually during parts work, but I'm sure maybe in Australia it's more common. I'm not sure. They're stereotyping the Australians there. So once we connect with the part, then we like, essentially the patient kind of starts this internal dialogue with the part. And sometimes folks will actually, kind of like in their in their head, they'll kind of like, hear the part talking to them, or they'll just get a sense of what the part is trying to relay, or they'll kind of get a feeling, or sometimes the parts will communicate it with us by bringing up an emotion. So it might be like, okay, I feel like this tightness in my chest. Okay, is there like an emotion associated with that? Yeah, it feels like anxiety. Okay, are you in your self energy? Yeah, no, I'm still feeling nice and grounded. I'm just kind of feeling like there's some anxiety, sitting here in my chest. Like, okay, can you ask that anxious part to, tell you about, how old it is, kind of when it came into being, and then maybe it's like, oh, like I'm hearing, 5 years old, and it's when my mom was, yelling at me for having dirty jeans. But it also might be more of like a, well, like, I'm just kind of getting this memory of myself, like, as a young kid. Like, yeah, just I can kind of like see my mom, like, yelling at me for like, I was always trying to keep my room clean. I remember this one time, like, I just had like one teddy bear in the middle of the floor, and like she just really laid into me for having a messy room. And, like, so sometimes the parts will communicate with us through memories. Sometimes folks kind of hear things. Like, there's different ways that people get into this, and sometimes it does take a little bit of time. Some of us are very energetically sensitive, very like in tune with our kind of internal systems, and like they just, flow like this, no problem. They've done, guided imagery and guided meditations and different things like that before. And like it's very flowy and easy. I have other folks where we go into it and I'm like, oh my gosh, like this is like, a big, like, rough and tumble guy. And like, how is he going to sink into this? And like sometimes it takes, a session or two, but then, it's just like, oh my gosh, like you're totally flowy and, totally getting into this. And it's great. So like, in my opinion, anyone can do this. It just, of course, there has to be a willingness to want to do it, but then also like it can take a little bit of practice. But there's good workarounds, lots of little tips and tricks that we learned during IFS training that can help us to get into the meat and potatoes of things. So once that connection is once we've connected with the part, kind of see where it's coming from, then we can actually do some healing work with that part. And so a big uh, sort of theme, or a common theme, would be doing something called a do-over. um, and so if, say that, say, running with this example, so, our 35-year-old's in for IFS therapy. He feels that anxious the tightness in his chest. It's that anxiety, like, oh, I can see my mom, freaking out about that teddy bear. Then what might happen in that scenario, and every case is going to be a bit different, but what might happen in a scenario like that is like, okay, so can you, as your present day self, you're there, so you're kind of seeing your 5-year-old self there, feeling all upset. Your mom's yelling at you. Can your present day self like go into that situation and see like, what does 5-year-old you need? And it might be that 5-year-old him needs like just a hug, and to say, hey, no, like you're lovable, like it's okay, like, just it's might just need some like love and support. Having like kind of a grown up there to just be like, no, no, like you are lovable, and this is, you didn't do anything wrong, and it's okay for this, and like this is stuff about your mom or whatever. Some people might need to go into that, into that situation and be like, tell their mom to like just back off, and like maybe, chew out their mom, and like have somebody like come in and like really defend, what's going on. Or maybe somebody needs maybe he would need his present day self to come into the room and be like, hey, like let's all have a group hug, and be like, hey mom, like you had a bunch of stuff going on, like I think you need a hug. And like, hey, little 5-year-old me, you need a hug. And like, so it just really depends on what the patient's psyche needs. But ultimately they kind of have a do-over where their present day self, which of course is more mature and experienced and wiser than their 5-year-old self, comes into this onto the scene, and sees like what would ideally have been done back at that time. Of course, there's no time machines that can go back and actually redo these things, but the subconscious mind, to my understanding, doesn't really perceive time the way that our conscious minds do. And there can be this profound healing that happens when that type of thing goes on. And I say that because patients tell me, like, I feel so much lighter, I feel better after, sessions. Like, oh, I'm not feeling as anxious, I'm not as stressed. Like, I got 95 on the exam, and like it didn't bother me at all, and I was really proud of myself. And normally I would have gone and eaten a chocolate cake if I didn't get 100. So like, so again, the proof is in the pudding. But then also patients, when they're doing these exercises, I have my box of tissues right beside their seat. It's always like, we don't start until you have a tissue in hand, because we know we're gonna need them. And so there's like these emotional releases. Patients feel a lot better, and so it's this really profound healing that can occur when this internal work is done. There's some other steps afterwards, something called a retrieval. So where basically, if parts are kind of stuck in the past, like if that 5-year-old part's still stuck back in the past, then do work go through some steps where the part is retrieved back into the present. So it's not like this 5 year old stuck 30 years ago in this scenario. And then also do something called an unburdening, which is where all of the stress and tensions and negative energy that have been held on by that part are just able to be let go and released. And there's like a certain process to that that's done, but I won't get into that now because I have the patient in 3 minutes and I need to wrap this up. But it's all talked about in Dr. Schwartz's book, the Internal Family Systems Therapy book. So we essentially, with parts therapy, can work with the different parts that come up, and with each session we just kind of see like what comes up. And if a patient comes in saying like, yeah, like I've been doing a lot better with anxiety, but like my mood's kind of been low, it's like, okay, we can go in with an intention and be like, yeah, let's kind of explore that. Sometimes it's just, we just go where the parts lead us. It's always a parts led process, but sometimes we kind of go in with an intention, sometimes not. And I have patients where we started doing parts work and then they're doing a lot better. And then it's like, well, we say, oh, let's do another session just to see if there's anything missing. And like nothing comes up. And it's like, great, we're good. You're done. So it's not to say that there's always parts to work on. We just kind of do the healing as needed. And then we're done. Um, One of the things I really like about parts therapy is that as patients, I've had this experience with several patients now where once they've done enough sessions, they kind of get used to like the lingo and the methodology and all of that. They start doing parts work on themselves. And it's just so gratifying as a clinician to see that, because it's the way I frame it is like, I'm really just kind of the guide to like walk them through it because I just happen to know more about parts therapy than they do. But then as they're doing this work, then they're like, yeah, I met another part and I did a retrieval and an unburdening and, and did that healing work and that was it. And then they might come and say, but I have this other part that like I'm kind of stuck, so I need your help. And so we work on that. But it is actually like developing if um, parts therapy is a skill that can be developed and one can kind of do that work themselves too. And I've certainly done lots of parts work on myself since I learned about this a few years ago. So I think I will leave it there because I need to get to my next patient. But that is parts therapy in a nutshell. There are many clinicians out there that do parts therapy. Again, it's been around for 20 years. There are different certification programs, all of that. So there's lots of IFS therapists out there. Here in Nova Scotia, where I am, like there's I think like at least a dozen or so IFS therapists. Like, and then every province or state that I've ever referred someone to and to look for parts therapy or recommended looking into it, like no one's ever said like, oh, I haven't been able to find anyone. I mean, maybe up in Nunavut, where I don't think we have that many people up there. Maybe there's no IFS therapies up there, but pretty much any place that has a population of at least 1 million, you're probably going to find at least a few parts IFS therapists. But again, the book is great. There's also an IFS workbook too. So for folks who are kind of just wanting to explore this a bit more, maybe they don't have like super deep seated trauma and not necessarily feeling like, oh, I don't really need to like work with someone, but I want to like explore more than just the reading the core book. There is an IFS workbook as well, and I think that's all that I want to say about it. So I hope that this was of interest. And if you are watching this on YouTube as opposed to listening to it on a podcast platform, and if you have any experience with IFS therapy or any thoughts or comments about anything I've said here, then please post in the comment section because I'd like to hear what folks have to say. And I'll leave it there for now. So thanks for listening to this episode of the Overcoming Chronic Illness podcast or the Optimistic Future podcast, depending on which platform you're watching. If you don't mind, liking it, posting a comment, etc., I'd appreciate it just to get more outreach out there, more exposure so other people can find the podcast. And thanks for your attention, and please stay tuned for the next one.